take a pause is not quite accurate. We'll recess for 5 minutes.
Test, test, test. Test. Test, test. Test, 1, 2, 3.
Alrighty, it's 10:39, coming back from recess. Looks like we've got our audio back up. Do you know when we lost audio? No, okay. Yeah. If you
Okay, so I'll just repeat then the highlights. Currently, our 2-week incidence rate is just shy of 165 cases per 100,000 population. That is a high for the county since the inception of the pandemic, and just a little bit below the metric for designation as safer at home level 3 high risk. So the next threshold is 175 cases per 100,000. It is our hope that the recent data dump from the Kaiser Permanente tests, perhaps on a condensed time frame, may have inflated a little bit those numbers, the incidence rate, and also the 2-week average positivity, which currently is 6.61%. The coming days will tell whether that is, the data in the coming days will tell whether that is actually the case or not. Some interesting context from a statewide perspective. Of all the confirmed cases of COVID-19, only about 13% were symptomatic. So upwards of 87% of confirmed cases of COVID in Colorado did not have symptoms. That illustrates the importance of wearing a mask and other protective factors, because the vast majority of folks most likely do not know that they are infectious and shedding the virus. The reproductive value, or the R0 value, statewide is about 1.5. I'll say regionally, in the east central area of Colorado, it's thankfully lower. It's about 1.11, according to the latest modeling estimates. Certainly our ultimate goal is to identify 100% of all the cases that are currently infectious. We are working on capacity to achieve that. However, that is most likely an aspirational goal rather than a reality that we can achieve.
If I could, you had mentioned a little bit earlier the reporting of serology. The serology positives are not included in the cumulative incident rate. That's just PCR, or has that changed?
I believe that's accurate.
Okay.
I will verify that.
Okay. It doesn't change that it adds to your workload, but
we are reporting them separately because of the
right.
kind of disparity in time, current infections versus prior infections.
Okay. Thanks.
Along those lines, I do want to acknowledge our case investigator and contact tracer, Catherine Reiber, who has been doing fantastic work, and we would absolutely not be in as good a place as we are with connecting with positive cases and providing support to schools and businesses and things like that who we get at least one call, sometimes multiple calls a day from folks or schools that indicate that they are in need of guidance for either confirmed exposure or suspected exposure to someone that is infectious. So thank you to Catherine and to the rest of the Elbert County leadership team that we check in with every morning. I do want to reiterate that anyone that would like to receive the daily updates, the situation updates, can connect with me via email or phone. All I need is an email to include you on those updates. We did have a call this morning with school superintendents. We are most likely going to craft a letter to parents of school-aged children to reinforce the need for protective measures, including limiting or eliminating travel, whether that's business or leisure travel to counties or other communities, whether they're on the Front Range or in the mountains that have higher incidence rates and positivity rates than we do. It is our belief that a majority, more than 50%, we speculate, it's hard to tell with definitive data, that a majority of folks are being exposed to the virus outside the county, and then bringing it back in the county and infecting household members, family members. We still continue to have community spread of the virus, but that is, we believe, a minority. Perhaps 15% of cases we believe are being transmitted within the county geography.
Yeah, and just, if I may, and that's just generally based on, these are folks that don't travel outside the county, but we haven't, my understanding is we still haven't identified any specific site or event where transmission took place, or certainly no, or if we have, I don't want to put you on the spot.
We believe that's accurate.
Okay.
Not,
Yeah,
and certainly not with any significant volume of cases. Yeah.
I mean, still primarily, I mean, household, within households, and then unidentified.
Yeah.
I haven't left the county, but I have it, and nobody in my family does, so.
Commonly, folks will tell Catherine that they're hard-pressed to identify where they may have been exposed.
Yeah.
They might say, I've only been to the grocery store, I pretty much stay at home.
Yeah.
So it is challenging. Transitioning to environmental health, an environmental health update. Year to date, our environmental health specialist and program led by Stacy Reinhardt, the county's issued 570 septic permits. Our septic revenue is slightly over $134,000 year to date. Food licenses include 68 that have been issued thus far this year. Our food license revenue, a little over $79,000. Our vital records, we've issued 38 birth records and 11 death certificates. I want to thank Valerie Warhay for her work with vital records. You may know that Valerie has transitioned to a new role within Human Services. That has necessitated a temporary suspension of issuance of birth and death certificates in Elbert County. We have coordinated with CDPHE's vital records at the state, and Tri-County Health Department has graciously agreed to step in and assist with issuance of vital records for Elbert County residents that need one. Once we get staffed back up, we'll get someone trained in vital records and resume issuance of them on a local level. Our vital records revenue is $797 year to date. just looking at, I believe, the septic permits that have been issued, we are down in terms of volume compared to prior years. And I'm looking for the exact number. So this is only through, I believe, September 30th. We're at 570. For comparison, in 2019, there were 635. 2018, 681. 2017, 644. So a little bit down, and of course we're going into colder weather, and we'll be issuing fewer permits with less construction going on.
But on those permits, though, that's not necessarily all new building, right? Because anytime somebody sells a house, they've got to get their septic inspected. I just want to make sure people understand that
Yes.
that's not new septic systems going in.
Correct, and thank you for touching on that point, Commissioner. So that includes new permits, permits for repair, and use permits. So that is a cumulative total of all those types of permits.
And again, I won't put you on the spot here, but the food permits, restaurants, trucks, etc., renewals, that's probably one we want to look at over time as well, just to, those businesses have been struggling, so I'd be disappointed for the individual business concerned if we're starting to see those drop off,
Noted, and I'll share that with
if
Stacy.
Stacy
Yep.
has I know you're slammed with lots of things, but if time allows over the next week or so, if there's something we need to know on that, please let us know.
Moving on to a brief update on mental health, behavioral health. In speaking with Sandy Grave County Coroner, there was 2 additional suicides in the past week. That puts our deaths by suicide, our year-to-date total at 9. I've just had some informational posters printed that we hope to get out to local businesses with resources for mental health, behavioral health. I've also been in regular communication with CDPHE's Office of Suicide Prevention. The challenge right now is obviously just finding time to put that together and operationalize those plans. But certainly we'll get to that as soon as we can. I believe...
Is that number typical, or is that more than, say, prior years?
It is atypical. So 9 in the first 10 months of the year is a high number for probably at least the last decade, I believe. A previous year's high that was maybe 6 years ago was 7 deaths by suicide in a calendar year, in a 12-month calendar year. So,
And I believe that was a year where there was unfortunately a spike in one of our school districts of several school-age kids.
I believe these latest 2 did involve what could be characterized as folks who certainly could have benefited from behavioral health services, mental health, counseling. So that continues to be an evergreen challenge. And I'll end the update there. Happy to take any questions about any topics or other issues.
I just, probably over our next morning huddles over the next few days, we should probably look a little bit about what plans for our staff and opening of we still represent a place where the public can congregate. We're primarily been taking folks by appointment. I know elections are going on, but if you want to probably think a little bit about whether it's safer to keep more of our folks at work from home or rotate staff. I mean, it's always best to reduce contact, but
Yeah, to
also-
that point, in the Colorado Dial framework, it is recommended in the current Safer at Home Level 2 status that we're in for upwards of 50% of staff to be working remotely. So I'd certainly encourage folks that can work remotely to seek approval from their supervisor to do so.
All right, anything else? I think that's all we got, but I appreciate the update. Hopefully we'll see, we've crested and we'll see a dip after this data dump happened, but I guess the only other one is, I'd assume that CDPHE is triple scrubbing everything now to make sure that we haven't missed a big provider of tests for, I mean,
I've not
seems
heard an
like that's
update
a
on
hard
that.
one. It's just to miss Kaiser Permanente tests for 3 or 4 weeks just seems like there were a lot of, I mean, I know that everybody's running in about 12 different directions, but it just, you know, that's one of our bigger hospital healthcare systems in the state, and to
Certainly.
miss tests for weeks without noticing that, nobody's going to get tested.
Yeah, and I cannot speak intelligently on their checks and balances
Yeah.
on how they do that, but I would anticipate that that was probably a general reminder, and it's probably worth noting, that they did catch it without any more time going by. So,
And then I guess the last one I had, I think I saw Sam had forwarded you the note. CCI was doing a call tomorrow at 8. I think Douglas County was just wanted to have some discussion about a proposed fourth factor for the dial that accommodated the uniqueness of smaller counties. I'm not sure if that registered in your emails, and I'm
So-
not sure exactly what they're proposing, but I was going to listen.
that has come up in conversations with local public health agency directors. That is a tall order. In an ideal situation, there would be additional metrics for consideration for certainly rural and frontier communities, or individual communities within a particular county. And just by way of a local example, I probably mentioned this before, I tend to not worry so much about SIMLA, as obviously some other communities on the western and northwestern part of the county. It's just really tough to come up with metrics that can satisfy the needs of so many diverse populations and counties. But certainly if they do.
Yeah, I was just curious, because when it comes down to it, Douglas County is not a small rural county, so I'm not sure if they're looking at parsing out the county as you described, or they just consider themselves small compared to their bigger neighbors. But anyway, I guess more to follow.
Yeah, I don't know if everyone realizes that even though we're a small county in population, I think in terms of 64 counties, we're probably like, 20-something in population.
Yeah.
I mean, there's more than half of the other counties that have fewer folks than we do. So certainly if we're looking at populations under 50,000, that's probably 75% of the counties out there. So.
Okay. Well, I guess with that, we'll close as the Board of Health.
Mr. Chairman, I move we close the Board of Health meeting.
I'll second.
We have a motion and a second to close as Board of Health. All in favor, please say aye.
Aye.
Aye. Thank you, Dwayne.
Thank you.
Thanks. And I guess with that, we'll I'll take a motion to reopen as the Board of County Commissioners, and then we will recess.
I'll make a motion, we open as the BoCC.
Second.
Okay, motion and a second to reform as the Board of County Commissioners. All in favor, please say aye.
Aye.
Aye. All three of us are still here. So with that, say we are in recess until 1 p.m. at the fairgrounds. We've got 3 land use items listed, Messer Arena, the Silver Creek Shooting Club. Both of those will be continued to future dates. The only item we have for full consideration is a Viero Tower in the Matheson area. So with that, we're in recess. Thank you.